When people come to us and complain of almost a daily type of a problem that they have, and we know that there's a good treatment for it, this is one of the reasons that we recommend a suburethral sling to them. It's not that surgery itself is without any potential complications. Any kind of surgery can have complications, but because of the minimally invasive approach that a sling has, those complications tend to be very rare and tend to be relatively minimal. The sling procedure itself involves making a small incision just underneath the urethra through the vaginal tissue that overlies the urethra itself. We then create a small tunnel on either side of the urethra that allows us to place the arms of the sling, which is basically a very small, narrow strap, on either side. And then what it does, it helps hold the urethra in its normal anatomic position. Once the sling is properly placed, there's then a suturing of the small incision that's made through the vaginal tissues, which is about 1 inch long. The sutures are absorbable, and so people don't have to worry about having them removed afterwards. And typically they're able to resume relatively normal activities within a week's time. Suburethral slings typically are done as an outpatient, so a person shows up to the hospital beforehand, maybe an hour or two before the procedure is done. The procedure itself may take as much as 30 minutes. They then go to the recovery room, perhaps for an hour, and then the post-operative floor for another hour. And so it's a half a day in the hospital. We normally tell people they can resume relatively normal activities the next day. In other words, oftentimes return to work unless they have a lot of heavy lifting or pushing or pulling involved in their work. Medical clearance before any type of surgical procedure is predicated on a person's health history. If they have a significant medical history, in other words, a lot of health problems, they oftentimes will need to be cleared by their primary care physician. If a patient has cardiac issues or has a history of cardiac problems, they oftentimes will require cardiac clearance from their cardiologist. This may or may not require an additional visit with their specialist or with their primary care physician, but oftentimes if they've been seen relatively recently, they can just get an approval from them either by phone or by email. Any outpatient surgical procedures require transportation by someone else to bring them to the hospital and someone to be able to take them home. That person doesn't necessarily have to stay at the hospital while the procedure is being done, but there has to be documentation or at least confirmation that there is someone who can take them home, because any type of an anesthetic, even if it's relatively minimal, may alter a person's ability to drive safely. So we want to make sure that they have someone that can bring them to the hospital and take them home. For the most part, patients don't have to do much extra before their surgery, other than we'd like to see them for their preoperative visit here in the office. That allows them to get antibiotics if they're necessary, or get any pain medications that are necessary before the surgery. And that way they can have it waiting for them when they get home. The antibiotics that are associated with the procedure are generally administered at the hospital, so for the most part, they don't require anything extra. As with any surgical procedure that requires an incision, we try to avoid those medications that could have an adverse effect on the body's clotting system. That typically involves aspirin or aspirin-like products, which we usually recommend stopping 10 days before surgery. Other non-steroidal anti-inflammatory medications like ibuprofen, we typically recommend that they stop that anywhere from 3 to 5 days before surgery. If a patient is on anticoagulation medication because of a history of blood clots or cardiac issues that require anticoagulation, we oftentimes will have them stop that at least 3 or 4 days beforehand, depending on which agent they're on. And we oftentimes will coordinate that with their cardiologist or specialist who manages their anticoagulation. Just like any surgical procedure, the old adage of nothing to eat or drink after midnight doesn't necessarily apply, because some of these procedures are done in the afternoon. For the most part, the anesthesia specialists require that a patient not eat or drink or eat anything solid for at least 8 hours before the procedure, and they can drink clear liquids, which includes water and apple juice and things that are clear, up until about 2 or 3 hours before the surgery. We generally recommend that people wear very loose, comfortable clothing to the hospital. You want to be sure to bring a pad of some type. Even a panty liner is usually adequate because there's not much vaginal bleeding after the procedure. The other thing we recommend is that if people have piercings, you try to remove whatever piercings are removable, and then also don't wear any jewelry to the hospital. Make sure that you minimize or avoid any makeup, and we typically recommend that at least one finger not have nail polish on it, because they oftentimes will check your oxygen level through that fingernail. So the day of the sling procedure, at least through the hospitals where we work, the patient is required to come to the hospital about 2 hours before the surgery. This allows the staff there to go through all their paperwork, make sure they review their medical history, and allow the anesthesiologist or the nurse anesthetist to interview them to explain what the anesthesia involves, but also for them to also review the history. Once a patient gets to the hospital, they're usually taken to the pre-operative floor, where the initial staff go through their steps. It takes about an hour, and then 1 hour before the surgery, a patient goes to the pre-op holding area, which is right outside the operating room region. There, the anesthesiologist typically will start an IV, get medications or fluids run through the IV, and any type of sedative. The surgeon will also then talk to you at that point to make sure that the consent is properly signed and make sure that there aren't any last-minute questions. Once the surgery is completed, a patient typically goes to the recovery room for about an hour or so, depending on how much anesthesia they receive. And then once they're a little bit more alert, they're then transferred to the post-operative floor, where they're also observed for at least an hour or so. And one of the requirements is that they're able to void properly, and then the nurses will oftentimes check with a bladder scanner, which is like an ultrasound, to be sure that they're emptying their bladder adequately. Most of the time, one of the questions I'll ask people in the preoperative area is, are you a little nervous? And if they tell me no, then I actually inquire, well, you understand this is going to be surgery. So it's very natural to have some degree of nervousness before any surgical procedure. To allay some of those fears, one of the most important things to remember is this is a relatively minimally invasive procedure. In other words, there's not a lot of incisions or cutting going on. There's not a lot of risk of blood loss. There's not a lot of risk of infection. And because of the minimally invasive approach, patients typically do very well. The amount of pain they have afterwards, which is again something I think that brings about some anxiety, is the anticipation of pain afterwards. Most patients tell us they really don't have a whole lot, and I think that's generally true. If you have questions before the procedure, if it doesn't seem clear in terms of the explanation that was given at the office, you can always call the office, and here at Valley we have a good patient portal system that you can send messages through that, which allows us enough time to review what your question is and get back with you. It's kind of like text messaging, and it really is very convenient, and sometimes a little bit easier to get through to us than to try to reach us by phone. That being said, we do have phone nurses that are available all during office hours, and then also answering service that's available after hours, although then you would speak to the physician who's on call rather than your own surgeon.